Welcome to Better Health News, where we share the latest health tips supported by medical research. Today's video is on how breast density affects cancer detection.
Welcome to today's video, where we share some important changes in women's healthcare regarding their breast mammogram reports. As of September 10, 2024, a new rule from the Food and Drug Administration, or FDA, went into effect, requiring mammography facilities across the United States to notify women about their breast density. This update could be life-changing because studies have determined that women with denser breast tissue having a 4-6 times greater risk of having breast cancer compared to non-dense breasts. So what are the risks? Well, about 13% of women in the US will develop breast cancer, with breast cancer being the most common cancer among women. And surprisingly, 85% of those women will have no family history of breast cancer. So, knowing your breast density score will help you and your doctor make better informed health decisions. So, let's find out what this means for you. First, let's talk about what breast density is. Breast density refers to the amount of fibrous or glandular tissue compared to fatty tissue in the breast, and it's typically classified into 4 categories: A, B, C, or D. Women with denser breasts, like category C or D, have more of that fibrous tissue and less fatty tissue. Now, why is this important? Dense breast tissue can make it harder for mammograms to detect cancer because both dense tissue and tumors appear white on a mammogram, as you can see here with this small white tumor spot. This means that breast cancer could go unnoticed in a routine mammogram. Under this new FDA rule, all mammogram reports are required to notify you that your breast tissue is either dense or not dense. This will allow you to be more informed about your health risks and possible additional testing. If your breast tissue is not dense, the report will say, "Your breast tissue is not dense." If your breast tissue is dense, the report will say, and I quote, "Breast tissue can be either dense or not dense. Dense tissue makes it harder to find breast cancer on a mammogram and also raises the risk of developing breast cancer. Your breast tissue is dense. In some people with dense tissue, other imaging tests, in addition to a mammogram, may help find cancers. Talk to your healthcare provider about breast density, risks for breast cancer, and your individual situation. So, note here that it says you may need additional tests. Typical further tests include ultrasound and MRI scans. In addition, the mammogram reports will not only say whether you have dense breasts, but will also include an overall assessment of the degree of breast density, using the 4 categories of A, B, C, or D. So let's take a moment to understand the 4 different grades or categories of breast density that women are typically classified into after a mammogram. This is really important because breast density can affect how breast cancer is detected and what additional steps might be necessary. Breast density is categorized into 4 grades by radiologists based on the mammogram results. Let's go over them one by one. First, category A, almost entirely fatty tissue. In this type of breast tissue, the breasts are made up mostly of fatty tissue, which appears dark on a mammogram. Here is an example of category A breast. This makes it easier for radiologists to detect any abnormalities, like tumors, which would appear white against the dark background. Only about 10% of women fall into this category. The second category is being scattered areas of fibroglandular density. This means that the breasts have mostly fatty tissue, with some areas of denser, fibrous tissue scattered throughout. Here is an example of a category B breast density. This is more common, and it makes mammograms a little more difficult to read, but overall, tumors can still be spotted fairly easily. About 40% of women have this type of breast density. Next, we have category C. Heterogeneously dense breast tissue. In this example of category C, you can see that more than half of the breast tissue is dense and white, with more of dense glandular and fibrous tissue, described as heterogeneously dense. This makes it harder for radiologists to see small abnormalities on a mammogram. Because dense tissue and tumors both appear white, it can be easy for a tumor to be hidden within the dense tissue. About 40% of women fall into this category. Finally, there's breast tissue category D. Here is an example. In this category, the breast tissue is almost entirely dense and white, making it very difficult to see tumors through a mammogram alone. This is the highest risk category when it comes to missed cancer detection through mammograms. About 10% of women have this level of breast density. To summarize, grade A, almost entirely fatty, which makes abnormalities easier to detect. Grade B, scattered areas of density, still relatively easy to read. Grade C, heterogeneously dense, where detection becomes more challenging. Grade D, extremely dense, which makes it the hardest for mammograms to spot tumors. So, if you're notified that you have dense breast tissue, don't worry. This is common. In fact, about 50% of women have dense breasts, with 40% being grade C and 10% having grade D. The key is knowing how it affects your health and what steps you can take. But here is the key point, and why the FDA added these new rules. Women with dense breasts, particularly grade C or D, may need, I stress may need, additional imaging tests, such as an ultrasound or an MRI, to detect cancers that a mammogram might miss. That is why the FDA added these guidelines. Obviously, too many women had hidden breast cancer with a so-called normal or negative mammogram. It's important to discuss your individual situation with your doctor, who can help you decide whether these additional tests are right for you. Your doctor can also guide you through your personal risk factors, such as age, family history, lifestyle, to determine the best approach for early detection. Also, you must continue to do your own breast self-exam in order to detect any sudden changes that should be checked out by your physician. So, what should you do next? After your mammogram, look for that notification about breast density. If you receive one, make sure to have a conversation with your healthcare provider about what it means for your overall breast cancer screening plan, and do you require any additional testing, especially if you have a density grade C or D, which again includes almost 50% of all women. Remember, knowledge is power when it comes to your health. Understanding your breast density and its potential risks can help you make informed decisions that could save your life or the life of a loved one. If you found this video helpful, don't forget to like us and share it with the other women in your life. And subscribe to stay updated on other important health topics, especially our video on the common heart attack warning signs for women. Your health is your greatest asset, so take charge of it. And remember our health motto of think well, eat well, move well, and be well. Until next time, take care.
Thanks for watching the video. And if you liked it, please hit the like button and give this a thumbs up. So until next time, be well, stay safe, and stay positive. Take care.